So we will start the session with an introduction with dry eye challenge and overview by Dr. Aswathy Unnithan. She is a consultant ophthalmologist and dedicated consultant at Precise Specialty Eye Care. Over to Dr. Aswathy.
Good morning, everyone. My topic for today's discussion is dry eye challenge and overview. Coming to the definition of dry eye, after the DUCE 3 report, now the definition of dry eye, it is a multifactorial symptomatic disease characterized by loss of homeostasis of the tear film and or ocular surface. The key pathophysiology of dry eye is tear film instability, hyperosmolarity, ocular surface inflammation and ocular surface inflammation and damage and neurosensory abnormalities. Now, there is an increase in screen usage among all populations and reduced outdoor activities, especially post-pandemic, and we are seeing increase in number of dry eye cases. Now, let us see what the numbers are saying over the years. An early study done in the early 90s called the Beaver Dam Eye Study showed a prevalence of 14.4% in dry eye. This graph shows increasing prevalence with age of dry eye symptoms. Now, this graph is showing increase in prevalence with age, and also in women, dry eye tends to be more. Then another study came, which is called the Beaver Dam Offspring Study. And here the prevalence of dry eye was found to be 14.5%. And here also women were having more dry eye, incidence of dry eye. Also, statistically significant association for dry eye was found with female sex, current contact lens usage, allergies, arthritis, thyroid disease, antihistamine, and steroid usage. This graph is showing increase in prevalence of dry eye with age, and also women is progressively showing increase in symptoms of dry eye with age. Then another study done by Papas et al. Showed global prevalence of dry eye at 11.59%. Then a study published in 2023, it was a hospital-based study. The dry eye disease, the prevalence was found to be 29.5%, and here it was predominantly evaporative type of dry eye. Then this study done by Tithya et al., here the prevalence of dry eye disease was found to be 32%, and severe dry eye was found to be 28.9% among them. And here there was in the 21 to 40 age group, then male sex, unlike in other studies, here the male sex, they were having more incidence of dry eye. Then urban population, desk job with computer usage were found to have increased incidence of dry eye. Then we are hearing patients with screen exposure of more than 4 hours or more were found to have severe dry eye. Also, cigarette smoking and contact lens usage had increased prevalence of developing severe dry eye. The most number of patients in the 21 to 40 age group were having dry eye, and severe dry eye was 29%. Then statistically significant association was also found for severe dry eye with patients having desk job and computer usage, smoking, and contact lens use. Now we are talking about adults. Now what about children? In children also similarly, increased exposure of screen time, especially post-pandemic, is happening, and increase in moderate to severe dry eye was found in children with increased exposure to screen time when compared to children with mild dry eye disease. And exposure time of 3 to 3.5 hours per day had significantly increased risk of dry eye. Coming to the conclusion, there is a steady increase in the number and severity of dry eye cases over the years. We need more multicentric studies in future to really assess the magnitude and burden of dry eye disease. Thank you.